a lot of people, when they think about glucose or high glucose levels, we only think about diabetes. And it's so much bigger than that. You know, glucose is at the core of our insulin and glucose relationship. And we know that metabolic health and insulin resistance, which is what occurs when that metabolic system has become dysregulated, it is the foundation for a lot of our most common chronic conditions. So cardiovascular disease, hypertension, dementia, mood, as we were talking about, just longevity and aging, all of these stem back to your level of insulin resistance or insulin sensitivity, and glucose is tied in with that. So if we care about preventing these major chronic conditions, we have to care about our metabolic health, and we have to be looking at glucose. And then just the day-to-day, you know, your mood and how you feel, as we were talking about, that glucose roller coaster impacts how you feel. Glucose is our primary energy source, and if our energy source is all over the place, it's going to impact how you're performing in your just day-to-day life. We see so often that spike and crash where it's called reactive hypoglycemia. You know, maybe you had a Starbucks Frappuccino with a bunch of sugar and it's liquid, so it gets digested really quickly. You're going to see a glucose spike, maybe to normal levels because you're not a diabetic, but then you're going to see a crash as your body tries to recover from this sugar bomb it just got. And a lot of people there, that's when they feel hangry all of a sudden. They're reaching for food again, or they're going for a nap. And that impacts how they actually feel in their day-to-day life. So we can see this, you know, the swings is impacted in your mood, fatigue, energy levels. So it's not just this bigger picture chronic condition, but also your day-to-day ability to be the best version of yourself, essentially.